Drink some water, share some love. Tell your body you're sweet enough. Drink some water.
Hello, welcome to Sweet Talk, the healthy drinking series with Lake Health and Wellbeing. I am your host, Isalean Phillip. This series is brought to you as part of the Your Sweetness Health Education campaign, which is geared towards educating and mobilizing the public to make healthier drink choices. In this episode, we're learning about different health policies that governments may consider to help reduce public consumption of sugar-sweetened beverages and promote healthier habits. Today, we're especially focusing on SSB tax policy, which is something that we've been hearing a lot about regionally. I'm really happy to welcome the esteemed Dr. Marissa Carty, who is the NCD Program Coordinator for the St. Kitts and Nevis Ministry of Health. Welcome, Dr. Carty. Good morning. Thank you for being on Sweet Talk.
Good morning, Isalean. Thank you for having me.
Of course. Okay, so we'll just jump right into it. And we've really heard about different health policies that governments have had at their disposal to help encourage the consumption of, to help change consumption behavior to reduce the negative health impacts of SSB consumption. And, we've had different discussions and conversations around things like front of pack labeling, banning the sale and marketing of these beverages in and around schools. And of course, we've been hearing a lot more about different fiscal policies like SSB taxation. So Dr. Carty, could you help to explain what an SSB tax is?
Okay, so the SSB tax, or sugar sweetened beverage tax, is an excise tax that is generally implemented in individual countries on sugar sweetened beverages. Now, primarily, this tax is paid by the business owners when the product comes in country at the customs. However, to facilitate this, the price of the goods being sold in the businesses are usually increased for the customers indirectly. Now, excise taxes can be paid by percentage of the goods, and this is usually referred to as the ad valorem tax, or it can be paid by the cost charged by the unit of the goods, and this is referred to as a specific tax. In our case, we would be using more of a percentage of the goods as our excise tax for SSBs in our policies.
Okay, so what percentage or what rates are being considered? What have been done? What have you seen to be most effective in terms of rates and tax?
Okay, so in case of St. Kitts and Nevis, we would be implementing more of a phased approach in terms of our implementation of the sugary beverage tax. In many of the countries that have already implemented sugar sweetened beverage tax, they have also used the phased approach, which allows them to increase the tax over time until they reach a specific threshold. And so that is why we are using best practices in order to inform our sugar sweetened beverage policy. And so our aim is to start with an excise tax of about 30%. It's a recommendation, first of all. So let me make sure I make that clear. It is a recommendation. We still have to go through the process of getting it to be approved. But we are starting with an excise tax of 30% on all non-alcoholic and caloric sugar sweetened beverages, with a review and a tax increase of about 5% every 18 months. And then we are hoping that this will carry us to a threshold of about 70%. So one of the reasons for using this phased approach is to allow for the businesses to be able to adjust and prepare for the new taxes as they are implemented, while allowing the Ministry of Health to also evaluate the desired behavior change and any achievements that might come out of implementing the tax.
Okay, great. So you talked about a few things there in that. So in terms of the objective and how this SSB tax is intended to help with the prevention and control of NCDs, what exactly is the objective, or the outcomes that we've seen in other jurisdictions or anything like that in terms of implementing this tax and the type of behavior change that we want to see?
Okay, so in some of the other places that have already implemented the sugar-sweetened beverage tax, for example, places like Mexico, Berkeley in California in the US, as well as even some of our Caribbean countries like Barbados and Dominica and so forth. What has been found is that there has definitely been a decrease in the consumption of sugar-sweetened beverages since those taxes have been introduced. So that's one of the greatest outcomes. One of the other things that especially this was seen in the Mexico review of their taxes was that there was an increase in the amount of water that was being consumed. So not only did they see a decrease in persons consuming sugar-sweetened beverages, but they also saw an increase in persons consuming more water, which was a good thing. But in overall, most of the evidence showed that there was an improvement in population health. They also showed that the implementation of the tax also led to an increase in generated revenue, which of course we understand why. But then there was also a potential for reduced long-term associated healthcare costs, as well as productivity losses with the introduction of the SSB tax.
Right. Okay. So essentially, we're saying there are many long-term benefits that are anticipated with implementing this tax. So it's over the time as you process them. That's, I guess, why you're also considering the phased approach to implementing the tax over time, because we're looking for more long-term benefits as opposed to super immediate. But okay,
exactly.
Great. That's really good to know. So, is there anything else that you'd want the public to know? I know we're trying to educate and inform the public about things that the government is potentially considering, particularly the Ministry of Health, in terms of how we can combat the non-communicable disease rate. So is there anything else that you'd want the public to know about SSB tax policy? We've got the essentials in terms of what it is, how it would be implemented, what the rate would be, and what the objectives and outcomes are. So is there anything else in general that we should know as quick info?
Sure. So I just wanted to let the public know that the SSB policy that is going to be implemented, or that we are recommending to be implemented here in St. Kitts, is not just a taxation policy. Yes, excise tax is a part of it, but we are working on a comprehensive policy that will take into consideration limiting the affordability and accessibility of SSBs. It will also provide public awareness opportunities so that we can inform the public of the harmful effects of SSBs. And we'll also be making recommendations for the allocation of the tax revenue. So for example, we're looking at making recommendations for the improvement of the school meals program, as well as providing safe drinking water infrastructure within our schools.
Wow, now, that's really great.
Yes. Now the policy is currently under review at the Pan American Health Organization. And once we receive that feedback, then our next step will be to have our stakeholders meeting where we would be able to share the recommendations in this policy with our stakeholders.
Great. So these are things to look forward to in the upcoming year. As obviously we know 2021 is coming to a close, but it's really good to know that this work is happening and we continue to do this. So this is all what we're advocating for here at Lake Health and Wellbeing with the Your Sweet Enough campaign. So happy to be a partner and support in terms of the work that you're doing at the Ministry of Health. Dr. Carty, thank you so much for your work. And thank you for joining us on this episode of Sweet Talk, nice, short, and sweet. So that's all for now. I'm your host, Isalean Phillip. Take care.